Hello, good day. I'm Dr. Alice Lam. I'm here to talk to you today about the very commonly used drug called Botox. Okay, it's a #1 used cosmetic treatment in the USA. It is approved by the FDA for both cosmetic and therapeutic purposes. Okay, people would ask, what is Botox? Botox actually comes from a bacteria that used to cause tetanus. The substance this bacteria produce would cause muscles to stop contracting, thus creating a therapeutic effect in very dilute concentration. Okay, so long time ago, people started using Botox for strabismus, which is an imbalance of the eye muscles causing the eyeball to deviate one way, and that was the earliest indication. And then as later on, we found out this drug can be used again in other places, such as in lines around the eyes, quote-unquote crow's feet, and glabella lines is like the frown lines right here, and then there are lines on the forehead, which is right here, and especially in aged men. Okay, those are very commonly used areas that we do day to day in our office. But okay, just to explain the action of Botox a little bit, Botox is actually called Botulinum Toxin A. It is originally made by bacteria. It's a toxin, but nowadays it's not made by the original bacteria anymore. It's made by a very harmless bacteria that is in our gut by E. coli. It's like a biomedical engineering these days. Okay, its action is caused by a blockage of the receptor for acetylcholine at the cell membrane level. Thus, so if the end target organ is a muscle, it will stop contracting. If the end organ is a sweat gland, it will produce less sweat. If the end organ is a sebaceous gland, it will produce less sebum. Okay, so the other places we commonly use, especially in Oriental patients, is that we have a very square jaw. So in square jaw, which is we call a hypertrophy or excessive action of this muscle right here, which is called the masseter muscle. Okay, by injecting into the muscle, there will be less contraction of the muscle. Muscles, interestingly enough, when they contract less, they become smaller in size. So when this muscle actually becomes smaller, we get a V-shaped face. That's what we use day to day for slim face. Okay. Now the other thing that we sometimes do is on especially younger ladies with very big calf muscles, like if they are dancer or gymnast or somebody who actually plays soccer, right? And by injecting into the gastrocnemius muscle, it also allows the muscles to shrink a little bit, allowing a much more streamline of the calf muscles. And sometimes we do it for the sweat glands, especially in the underarm, and by injecting into both underarm, we will block the sweat glands there, and then you have less sweat, which sometimes causes a lot of embarrassments in the summertime, and also less body odor, okay? Because if you have less sweat, you have less odor. And also, sometimes when we inject into the forehead, T region, T zone right here, and over the nose, where there's a lot of sebaceous gland, we also notice that there's a lot less sebum. So that's why you get sometimes maybe less acne or less shiny nose or shiny forehead. Okay, in Hong Kong, the Botulinum Toxin A is available in 4 brands, and we use 3 brands in our office right here. Okay, we have the original brand from the USA, which is the Botox, another brand from the UK, the Dysport, and a Korean brand, CS. Okay. And if you have any other information that you need, feel free to contact us at this office here. I'm Dr. Alice Lam. Thank you.